Good morning, good afternoon, good evening, bonjour. Thank you and welcome to this presentation, this session this morning, sorry. There are 5 presentations today. I will start by introducing the titles and the presenters. We will go through the 5 presentations, and then there will be a question and answer session at the end of the 5 presentations. My name is Danielle Dorschner. I'm an ISQua member and I'm an IEEA surveyor, and I'm very pleased to moderate this session for you today. The first presentation is Grounded Accountability from the Front Line, Insights from Healthcare Settings, and that presentation will be done by Maureen Flynn. The second is called Project Excel the Quality for Excellence Q4E program, and that will be Gaurav Loria, followed by Ms. Ling with Innovative Multidisciplinary Information System and Case Management System can enhance post-acute care and interdisciplinary quality of holistic care in patients after acute stroke. The fourth presentation is Maria Scherbert, who will be talking to us about interventions to prevent or reduce rationing and missed nursing care, a scoping review. And our last presentation will be Alexandra Shaw on the Global Patient Safety Collaborative. Thank you, and let's start the presentations.
Hello, everybody. I'm Gaurav from Apollo Hospitals Group, and I had quality and operations there. And I also have my colleague, Dr. Sagar, with me. We have actually worked together on this project, Project Excel, the Quality for Excellence program, which we would like to talk about today to all of you. So Apollo Health and Lifestyle Limited is basically an umbrella company under Apollo Hospitals Group that has multiple, business units like the ambulatory care centers, diagnostics, dialysis, the secondary care centers for treatment like mother and child units, cradles and spectras. These are smaller units which are spread out across the country. So why we started this program was, initially it was a big challenge for us to monitor the quality of all these smaller units because they were completely spread out. We did not have, really smart people working in these organizations that could be given the responsibility for quality overall, being smaller units, obviously. And so we had to identify people who could be trained and elevated to the next level. So keeping all that in mind, and also to ensure that, we standardize some kind of data collection that we are doing from all these centers. So we get an analysis and a trend to understand what are the improvement needs that are required for this kind of an activity. Some kind of an external evaluation and assessment to know, how can we improve? Because as I said, the smaller units spread out, it's important to also have an oversight on what's happening and, how can we continuously improve in these areas. As well, look at some of the very common and the basic processes in a healthcare institution, like incident reporting system, the patient employee satisfaction and stuff like that. And then obviously at the end, looking at the award and recognition program. So when we started this, as I said that, we did not have an objective mechanism to rate the performance of all these centers. They were raising about 20 complaints per day and many critical processes were not monitored. So we started with some kind of a baseline in our mind and set a target for ourselves. What would be the quality for excellence, which is Q4E score. The surveys that we do, which are the external surveys, what would be the score for those? The number of incidents that are reported, the hospital infection rates, which is a direct indication of, how the hospital clinical services are being performed, as well as the net promoter score, which is again a direct indication of how happy your patients are with you. So we identified that there was a scope for improvement and, how did we go about to this? So what we basically did was we created a whole structure around it that, starting with having a list of indicators in place, which were relevant to that kind of a set. So for example, the list of indicators or KPIs that were specific for a mother and child unit were different from diagnostics and different from ambulatory care centers, as well as different from the dialysis clinics. We created a dashboard. We identified the baselines, the targets, the benchmarks, what we want to achieve. We trained the staff around those, giving them a whole download of how they should collect data so that there is standardization, how they should monitor, and how they should report this data. We pilot tested this whole process in some of the units, and when we got the results out of that, we rolled it out across all the business units. Monthly data collection was started after appropriate staff training on these. And when the scores came in, after 2 months, we started asking them for action taken reports for the lower scored areas. Then we also started looking at the trends. So for example, waiting time was an issue across 10 out of 20 clinics. Let's say seroconversion rates were an issue across 13 dialysis centers out of the 200 dialysis centers. So we started looking at the trends from different business units, and then started focusing on them, picking up specific projects that we could pick up, and started looking at those on how we could improve. Obviously, this data which was coming in through people, we had to look at the validation and analysis and actual implementation on the ground. So we started doing quality for excellence surveys and started monitoring their scores as well. Many times these were actually mystery surveys, and this was conducted to understand what's happening on ground in real time. At the end of the cycle, what was very important was the awards, because rewards and recognition becomes an important project or a part of any important process that we have to implement, so that people feel that they have done a good job or there's a scope for improvement. And we utilize these annual awards, which was a financial award, as well as the whole award for the team, which we started implementing in all our locations. And what we started doing was, every year we modify these indicators based on the trends. Once we were done with all this, when we looked at our targets, based on the targets, what we were looking for, we actually did much more than the targets that we had set for us in the beginning of the year. For example, for the Q4E, the average score, dashboard score, we had set us a target of 75, while we reached 84 after a year of implementation. The external survey score, for which we had set up a target for at least, being, more than 85, we achieved 86 at the end of the year. While for a net promoter score for the patient satisfaction, we reached about 82 at the end of the year. This data showed a drastic improvement in different processes, systems across the hospital, reduction in hospital infection rates, improvement in the compliance to our hospital or unit policies, improvement in satisfaction rates, and other processes were streamlined. The ground staff who were there working, they felt much more empowered. They felt that they realized that they were accountable, they were responsible for certain set of processes. And when these things were questioned over and over again, there was a huge improvement that was seen in the overall process, obviously affecting, at the end of the day, patient satisfaction and employee satisfaction. And there was a teamwork which came in, because everybody started looking at data rather than talking in general. It was more about talking with numbers, which obviously helped us in improving the whole process and the outcomes. However, sustaining it, this is a very important process for any project or any initiative that we implement. So as far as sustenance is concerned, now we have a clear-cut plan on continuous trainings. Any new employee who joins the organization has to undergo an induction, wherein this becomes a very vital component on understanding what quality for excellence is all about, what are they expected to do in their specific roles, and how are they supposed to improve. What's their role in improving each of the indicators or KPIs that we have listed out for them. Obviously, the action taken reports have helped us to improve a lot, because that shows that it's just not about data reporting, but it's about closing the complete loop of identification, improvement, and then going back to again the identification cycle and continuously doing that. Recognition. We, besides just the annual Q4E awards, we have also started some other awards to continuously improve, which motivate our people. report these report any of the incidents, for example, the Good Catch Awards for those, or any of the outcomes that we started identifying. We started identifying team members who were the best team members for the quarter, which would have led to a good or a drastic change on a positive side in the scores of Q4E. So all these recognition definitely helps to sustain this initiative in a longer way. As I previously said that, we continuously evaluate and evolve. We have been evolving continuously on the Q4E parameters or the indicators, which helps us to improve, which helps us to identify what are the trends, which processes are stabilized and we need not monitor them any longer from a corporate perspective, and what is it that we need to focus on. However, before closing, I would also like to add that, in the last 1 year, we have also been able to launch an app for us, which any of the employee at AHLL, at our center, can download. They can report incidents. They can use any of the activities or components of the program that I just spoke about through the click of just a button on their mobile phones. And this has again helped us to improve compliance at a larger level in all our institutions, in all our centers within a system. I think it's the complete teamwork that has resulted in this, that has definitely helped us to improve. And we hope to do much better and continuously improve, because it's a healthcare organization and we can't stop at what we have or be happy with what we have, rather continuously keep improving and keep doing. So that was it on Project Excel from Apollo Health and Lifestyle Limited. Thank you.
Thank you very much for your presentations. Very interesting. I'm checking the question and answer box, and I would invite attendees to answer the. I have a question for Gaurav. You talked about the patient satisfaction as being something that was high, and the Net Promoter Score. Did you ask questions about how patients felt about being safer with this in place? Like, there's a feeling that they felt at safe when they went into Europe. Was there a question about that? I'm sorry if I missed it, but that would be interesting to me.
Yeah. Thank you so much for the question, and I think it's a very important point that you just spoke about. Yes, so we actually in the due course, when now we have implemented a process wherein we do this as a safety culture survey. It's not only for the employees that is done on an annual basis, but it's also done with a question that is added in the patient's feedback form, wherein they are asked a similar thing that, do you feel safe at Apollo hospitals when you are admitted, or, when you're getting a treatment done? And I think, one of the indirect relation of that is also the increase in numbers that we have seen over the past 37 years that we have been existing. So yes, in short, it's a specific survey that happens for employees on an annual basis, while for patients, it's just one question that is added in their feedback form.
I'm just saying again to the attendees, if you have any questions, you can use the Q&A box, which I'm moderating here. Is there anything else that the panelists want to bring? We have about 3 minutes left to this session. So is there anything else? Last minute, the floor is yours. Let me know. You have questions for each other?
I would rather say thank you to you for so beautifully coordinating this whole session. Thank you to all the panelists, as well as to ISQua for giving us an opportunity to be here today.
Thanks, Gaurav. Yes, it was my pleasure to do so. Yes, very good presentations. So seeing that there are no questions left, I think that we can close this session. We have a few minutes left where we made our goal to finish on time. Thank you again. It's been great. And I know there's a few sessions left, I think. So enjoy the rest. And remember that these sessions are recorded and you can go look at them, view them after the session. I think there's 24 hours that we need, but they'll be available for you again. Thank you.